Good morning and welcome to another installment of Coffee and Tea with AARP. This biweekly program is an opportunity for AARP staff and volunteers to speak with some of Connecticut's top decision makers and ask about issues that impact older residents. My name is Anna Doroghazi and I am one of the policy directors at AARP Connecticut. I'm excited to be joined by a terrific co-host today, Rich Bright, an AARP Connecticut volunteer from Seymour. Hi, Rich.
Hello, how are you?
Great. I'm also very pleased to introduce today's guest, Senator Kevin Kelly. Senator Kelly represents the 21st Senate District in Connecticut, which includes the towns of Monroe, Seymour, Shelton, and Stratford. In addition to being the Senate Republican leader, Senator Kelly is also the Senate Republican ranking member of the Aging Committee and the Legislative Management Committee. He also serves on the Executive and Legislative Nominations Committee. Thank you so much for being with us today, Senator Kelly.
It's always a pleasure to be with you guys. We look forward to it all the time.
Great. Again, AARP Connecticut and Senator Kelly have a long-standing friendship, and we enjoy working with you every year. And this year, like most years, we have had a lot of business in front of the Aging Committee. So just to get started, could you please provide just a little bit of background about who you are, how long you've been a legislator, and some of the roles that you play in the Connecticut General Assembly?
Sure. Well, first and foremost, I'm a father of four, grandfather to seven. Well, actually, it's six. The next couple of days, we'll have seven. But that's the reason why we do all this, is for our families and to make our communities better. Just by way of background, I started this whole journey a long time ago. I don't want to explain how many decades ago, but started in the Department of Social Services working on the state Medicaid program. And I realized that by the time somebody got to the state of Connecticut, their die was cast and that we needed to get to them sooner. I went to law school nights, got a law degree, started practicing elder law, and also became a member of the Southwestern Connecticut Agency on Aging, which administers the home care program for Fairfield County. Through both that advocacy as well as my experience in dealing with the state of Connecticut, it ultimately recognized that there are issues at the state level where the policymakers just didn't understand what normal people in Connecticut were going through as they aged. So an opportunity arose in 2010 when my state senator decided to run for Congress, and I threw my hat in the ring, and the rest is history. I've been on the Aging Committee, I've been on Insurance and Real Estate, Human Services, Children's, and so always bringing that advocacy of what we decide at the Capitol at the 10,000 foot level. You can't ever forget what happens back in your district and to the people that really is what the government's all about. So that's where we are. And right now, obviously, I'm the Senate Minority Leader in Connecticut. But, aging has always been near and dear to my heart. And so I remain the ranking member on that committee.
Well, thank you. Senator, you mentioned that you're a ranking member of the Aging Committee. What does it actually mean to be a ranking member? And what are some of the issues that the Aging Committee deals with each year?
Well, the ranking member is really the minority party chairman, if you will. The majority has the chair and the vice chair, but the ranking is the minority party's lead representative. And that's what that means is when I'm on that committee, I'm going to speak for the Senate Republican caucus. And so it's a bit of a leadership position, and you work with the leaders, the chairs from both the House and the Senate, in developing ideas and the agenda and moving things forward. Now, as far as the Aging Committee is their committee of cognizance, they are the only committee in the legislature that is exclusively the voice and looking at issues that affect seniors in the state of Connecticut. It's not specific to, let's just say, like finance or revenue and bonding. It's whatever happens to affect seniors in Connecticut. It could be a human service issue. It could be an employment discrimination issue. It's just whatever affects, and that's one reason why I like elder law, is it's the only part of the law that's driven by the individual, not by the body of law itself. So that's where the committee is, and we always look at whatever issues are affecting our seniors in the state of Connecticut. And going way back, when I first started with the chairman then was Edith Prague and Joe Serra, we always focused not so much on partisan issues, because whether we're Republican, Democrat, unaffiliated, or not even registered, the hope is that we always get older, but just not old.
And I'm really happy that you mentioned a lot of the bipartisan issues that come out of the Aging Committee, because AARP has bills in a lot of committees as well. And one of the things that I feel as an advocate and have experienced is just that the Aging Committee truly is a bipartisan committee, and that a lot of the bills that come out of that committee have good bipartisan agreement. One that jumped to mind right away was Senate Bill 56, an act deterring age discrimination in employment applications. We've had terrific bipartisan support on that bill in recent years.
As you mentioned, it has come out of committee a few times, and I know I voted for it, in the past. I voted for it to get it out of committee this year. It's a great initiative, because all it really does is it allows individuals the opportunity to get a chance to get an interview, and a lot of times if you can pick up on that, whether it's a graduation date, a licensing date, something to figure out, oh, this is somebody who's 60 years old. I don't want to interview that person, but I'll take the persons that are 30, unless there's a requirement. Like you need a bartender, so you got to be whether it's 18 or 21, you got to be a certain age. That's a different story, but by and large, it's not the case with most employment offers. And this is just giving older individuals an opportunity to get into the batter's box and have an opportunity for a job, because what we know is that they have the experience and capability, and if they're just given the opportunity, they will exceed.
Yeah, absolutely. And we really appreciate, all your support this year and past years on that bill. Another area where you have been a really strong advocate that's of big interest and importance to AARP is helping people choose where they live and receive services as they age. You've been a really strong supporter of aging in place initiatives and home and community-based services. You mentioned some of your professional background, working with the state, dealing with Medicaid issues. So what has led you to believe that aging in place is something really important? And then to expand on that, what more do you think Connecticut can do to support aging in place?
Okay, number one, when you talk about, when I go into a room on the campaign trail and I just ask a group of people who wants to go to a nursing home, nobody raises their hand, because everybody wants to stay at home and age in place. So that's where people want to be. When we look at the public expense, home care is about a third of the cost of institutional care. So it's less expensive. And now, armed with what not only the mathematical report showed from the COVID experience, we know that the health outcomes are better in the community. So if it's what people want by a wide majority, like over 90%, it's less expensive and better. Why aren't we doing it? I mean, it's just that simple. It's like, why aren't we doing this? Especially in tight times when we're looking at budgets that we, are getting too big and we need to do more with less. Well, here's an option that people want. It's less and it's better. So when people say, what can you do? Not enough. We need to be doing more. We need to really make a robust home and community-based service program and network so that people can have the options that they want. If it's the people's government, I don't understand why we can't deliver on that promise.
Okay, thank you, Senator. For the past year, it's been very difficult for a lot of residents in Connecticut, especially those older residents who are living in long-term care facilities. Can you reflect a bit on the state's COVID-19 response? What did we get right? What could we have done better? And what lessons have we learned?
This past year was one of the most difficult I've ever experienced, not only as a legislator, but as an elder law attorney. The conversations that I was having with individuals who were in nursing homes because somebody would be discharged from the hospital that they knew to be COVID positive, and to know that they're in a compromised position and they're stuck in a room with somebody and a virus they know can kill. So it was very difficult, and the number of people that I know who were in that situation and are no longer with us. This has been a very, very difficult year. I think the Mathematica report that the governor commissioned bears that out, and bears out that one of the direct causes was the low reimbursement rate of Medicaid, and that it just, there were so, the state was so unprepared, but it was unprepared because of the institutional and historic underfunding of the single payer Medicaid system that ultimately resulted in physical plants that didn't have the proper HVAC. They didn't have the proper PPE or infection control. They were paying their workers low wages, so they had to have 1-2 extra jobs, which helped cross-contaminate. And so it really impacted the quality of care. And this is why, once again, why I'm such an advocate of home care. So it's something that we need to look at and shine the light on. Now, what's disheartening is, armed with that Mathematica report, we don't see a line item in the governor's budget that's saying, let's increase the Medicaid reimbursement rate. No, instead, quite frankly, there's a cut. Well, I'm going to say a cut. There's an asset test being applied to Medicare Savings Program, which is going to become an impediment for people living in the community to get Part B premium help and assistance, which is preventive medicine. I mean, it's like, this is preventative care. These are the types of initiatives we need to embrace and expand upon so that people can have home care as an alternative, not look at it as like, well, that costs too much money. Let's put it an asset test on something where, Connecticut's unaffordable, and the income level is it's less than $2,000 a month. So you're talking about people that are maybe at 200% of the federal poverty level, and you think that they're sitting on these bank accounts that are just like millionaires. It's mind-numbing when you think about it. But that's what I try to do, is to be that voice, to bring that perspective to the legislature. One of the things that's very disappointing was that between the governor and the majority Democrats, they had a COVID task force put together, and they included the Public Health Committee, which deals with regulation of the medical providers. It had the Appropriations Committee, which is the state budget. It had Human Services, which is the Department of Social Services, which administers the Connecticut Home Care Program. It had Labor, which obviously dealt with things like the staff in nursing homes. But the one voice that was noticeably absent was the Aging Committee. And the greatest generation paid the greatest price during COVID, and I think that's a voice that needs to be heard. It hasn't yet, but when these issues come to the Senate floor, I'm gonna make sure the voice is heard, because it's one that I think is sorely missing and is necessary to make sure that we get this right moving forward, because it's that important. It's just there's so many things that this shine the light on. Social isolation. I mean, we could talk for hours.
And we did promise we'd keep this to half an hour for you. So, but I am glad that you mentioned, just the devastation that we've seen in nursing homes in the past year. I think we're right around 14,000 of our state's nursing home residents were infected with COVID-19 in the past year, close to 4,000 deaths. And as you mentioned, there were just sort of systemic failures behind some of those numbers that we saw. One of the areas where you have been a strong advocate for years on behalf of nursing home residents is around the personal needs allowance. Would you like to speak a bit to what the personal needs allowance is? This is leading the witness a little bit with this question, but why we're so overdue for increasing that amount?
Well, first, it's about dignity. What we're talking about are people who reside in a nursing home and have exhausted all their assets. They've had to sell their family home. They've cashed in their retirement. They've sold all their savings. They're now down to nothing more than their income. And of their income, everything gets turned over to the nursing home, but for $60 a month. Now, when I first was elected, the amount of the personal needs allowance was $72. By no means a lap of luxury, but it was 72. And under then Governor Malloy, he reduced it to save $1 million in the budget. 1 million. That's all it is. $1 million to the state budget. That's 20 some odd billion. It's nothing. It's a rounding error. But to the people that are in need, that's the difference between having shaving cream or not. It's the difference between having your hair or nails done on a monthly basis or not. It's what I said. It's about dignity. This is somebody who's lost everything. And $12 a month to get an extra $1 million out of the budget, to me, it's not dignified. Now, we've put forward a bill. My experience with Medicaid, I was able to find an adjustment in the Medicaid program that would actually change the applied income. It would bring actually more human services to the probate court process. And through that adjustment, it's going to free up $1 million to be able to give that $12 back to the family. So it's almost budget neutral. I did see a fiscal note and I've got some issues with it, but we'll work that out. But it should be budget neutral. But even if it's not, you just look at things like Boston Consulting Group. The governor has paid millions of dollars for these consultants to come in, like the Mathematica report, and then you get it and you don't do anything with it. Well, that $1 million makes the difference between, big difference in the lives of individuals living in nursing homes. And that's why this is so important. And I think we should be going further than $72. But, first things first, let's get back to where we were under Governor Rell. And then once we get there, we can move forward again.
Yeah, and we appreciate your support on that. I know that's one that we hear, and we've heard, a lot from nursing home residents and their families in the past year. But the personal needs allowance issue, goes back years. Also, staffing levels. A lot of the things that have really come to the forefront in the past year are not things that weren't on people's radar before, and it's just really unfortunate that it took a crisis of the magnitude of what we've seen in the past year to help us focus on, a lot of the pieces that residents and their families have been asking for all along. Which brings me to another bill that you've co-sponsored this year, House Bill 6552, an act concerning the rights of residents in long-term care facilities to use the technology of their choice for virtual connections to family, friends, and other persons. It is a very long bill title, but it basically just says if you reside in a nursing home, you should have the same ability to access technology as folks who live in the community. So why is it important for you to allow nursing home residents to have access to cameras or, other forms of technology in their rooms?
Well, because it's their home. If they were in their home in the community, they'd be allowed to buy a camera. Why is it when they have a physical limitation and they're in a skilled nursing facility, does that right and dignity to call wherever they're living their home? Why does that go away? And that's really what it's predicated upon, that there should be a zone of privacy. These are human beings. We can't take human out of human services, but that's what's going on. And so when we look at this issue, what you got to focus on is that most people in nursing homes have some sort of diminished capacity, whether it's a physical limitation or a competency diminishment. They are individuals in need. That doesn't mean they've surrendered their right to independence. or their right to association. And we know that social isolation is as much a driver of poor health outcomes as the coronavirus. And so you want to make sure that you don't have individuals who become socially isolated, whether it's in a skilled facility or at home. But this is what we need. Now, when the governor came along with the pandemic and said, hey, we're now not going to allow family members in to be with their loved ones, that created more of a need for technology. If I can't go in physically, I need to go in and be there technologically. Okay. Then when you layered on the immunity, you took away accountability. So now you have individuals with diminished capacity who are in, I'm going to say a skilled facility where they no longer have the physical interaction with their loved ones, and the accountability yardstick was removed from the industry. So you've put these people in harm's way. How can we start to try and bring eyes and ears, boots on the ground, the loved ones that care for these individuals? How can we make sure that they are ever present? Not only to give them hope and optimism that there still are people out here that love you, but also to make sure there's an advocate that's present to make sure that they're being taken care of on a daily basis, that they can put their eyes on what's going on and that their loved one is well cared for. It's not much to ask for. But in the process, you hear about the providers and they want immunity. They want the family members to be prohibited. The labor wants the privacy. But in this process, we've lost the person that matters the most, and that is the resident. And they should have the right to be able to call where they are their home and have a zone of privacy of whatever that is around them. And in that zone of privacy, be able to communicate in and out with other people if they cannot be there physically. That's really where it came from.
Yeah, and I appreciate, and want to thank you for continually circling back to this idea of the dignity of the resident. And one of the things that was so heartbreaking about the past year is that so many things happened to residents of nursing homes, and so few things happened with residents. I know, from AARP's perspective, but also personally moving forward, that's something that has to change. Older adults and people with disabilities still can meaningfully contribute to their own lives. And as a society, we don't let that happen. And that needs to be just a fundamental shift in our thinking moving forward. So thank you for addressing that.
A culture change. To be doing things for seniors, not to them.
Senator, before we let you get back to your busy day, what other issues are important to you in this session?
Well, there's I think we need to look at in the context of skilled nursing, like we just talked about, we need to focus on, look at and revisit the Bill of Rights. To make sure that it's there, make sure that the care model is patient-centered and patient-driven, because what I think we've learned through the pandemic is that patient has been lost in the shuffle, and that the focus needs to be once again reinstated on that individual to make sure that that's the primary reason we're here. It's not about everything else; it's about them, and how do we make a system that works better. We also have to look at ways that we can improve upon and create a more robust home and community-based service network. That is another thing that every year we keep going. I don't think we do enough. I think we can do more. It's a way forward. If we could get more people to age in place at home, that's less Medicaid expenses in the skilled facility, better health outcomes. And I think that's an area that we need to look at. And then, of course, there's always the issue of just making sure that we have the financial aspect of making Connecticut more affordable, whether that's lowering utility costs, whether it's lowering, the cost of gasoline or keeping it where it is, as well as just making healthcare affordable and looking at ways to make and drive down the high cost of medical care and prescription drugs. We've got a bill out there that's looking at, not only doing it for premium relief, but getting our arms around the real cost drivers, and looking at a bill that we also, I'm going to say, got out of committee when I was chairman on insurance. That was the prescription drug transparency bill, which was groundbreaking in its time, and that we're now getting a lot of the transparency on drug pricing and what are the cost drivers within that industry. And we need to take that information and start to utilize that and make smart policies so that we can drive the cost of prescription drugs down, because we all know that's the single biggest cost driver, and it would bring a lot of relief to a lot of folks. And, so those are just a few of the things. I mean, we're going a mile a minute, but they're all worth it, because at the end of the day, Connecticut's a beautiful state. It's a beautiful state because of the environment it's beautiful in that regard, but it's also beautiful because of the people that live here. And in my book, they're worth fighting for, and that's why I drive to Hartford all the time and speak up to make sure they're heard.
Great. Well, Senator Kelly, we know you had a very busy day today. We really appreciate that you made time to have the conversation with us. And thank you for always being willing to work with AARP Connecticut and for being a strong advocate on behalf of older residents. We really appreciate it.
Absolutely. And I would be remiss if I didn't also say thank you for your advocacy. I see that you're in your red, and while it's difficult in this virtual reality to virtually congregate anywhere, I miss seeing the red shirts. But your advocacy, bringing focus to the issues that face seniors in the state of Connecticut, is unparalleled. And without you, I think there wouldn't be as many things getting across the finish line. So I appreciate and commend you for your service and advocacy, and keep up the good work. God knows we need as much help as we can, but if we persist, I think we can prevail.
Thank you, Senator. On behalf of all the volunteers in Connecticut in the red shirts, we thank you for everything you've been doing.
Thank you.
Great. Thank you very much. And join us again at 9 a.m. on April 29th for the next installment of Coffee and Tea with AARP. Thank you so much to Rich Bright. Thank you to Senator Kelly, and have a wonderful day.